Marian Gfroerer has dialysis treatments to do the job her kidneys can't. That means a needle puncture in her arm 3 times a week. It's a lot to ask of her veins.
Well, just recently it clotted, so I had to go in and get it ballooned out.
Mark Millman struggles even more, undergoing dialysis 6 times a week. And when his own veins could no longer withstand the treatments, doctors implanted a synthetic vein in his arm. But that failed too, and now he has
2 synthetic veins.
This lab in Novato may one day be able to provide a lifeline for patients like Millman. Scientists at Cytograph Tissue Engineering are growing blood vessels.
We take a small biopsy from the back of the hand of skin and the small vein that's just underneath that incision. We take these cells, we grow them in special flasks until they make sheets.
Those thin sheets are then rolled around a cylinder, served a nutrient-rich cocktail, and in 6 to 9 months, a blood vessel is created. It can be used as an artery or vein.
And it is exclusively made from a patient's own cells, so to avoid any problem of rejection.
That's the theory, but Cytograph scientists couldn't be sure until they conducted the ultimate test. A blood vessel grown in this lab was implanted in the arm of a 56-year-old dialysis patient from Argentina. She's had it now for 7 months with no complications. Not only that, the patient's new blood vessel has withstood needle punctures 3 times a week.
Until now, there's never been a completely biological graft that could be produced in the lab that had the mechanical strength needed for blood vessels.
And unlike this synthetic blood vessel, the vessel made from a patient's own cells closes quickly when punctured, limiting blood loss. Dr. George Ting is the medical director at El Camino Dialysis Services. He has concerns about the months it takes to grow the new blood vessels, but he is encouraged.
I think it's an incredibly promising technology. If it works, it could be very, very useful for dialysis patients. It could spare them a lot of surgery.
Because the vein made from a patient's own cells is likely to last longer than a synthetic one. Dialysis patients aren't the only ones who might benefit.
It's also possible to use these grafts for other application, for leg bypass, for heart bypass.
Cytograph expects to start clinical trials in the U.S. next year. If those trials are successful, it could be 3 to 5 years before these lab-grown blood vessels are available to U.S. patients, like Mark and Marian.
Oh, that would be wonderful. Truly wonderful for people. That not worrying about all the other complications.
She hopes one day this lab may create a blood vessel for her that's as good as the one she was born with. In Novato, Marian Gfroerer, NBC 11 News.